Good morning. I'd like to welcome everyone to the Governor's EMS and Trauma Advisory Council meeting for February the 10th. The producers to my left are giving me the hairy eyeball because we weren't starting on time, so we'll go ahead and get it going. If any of you want to know what this is a large countdown timer in front of us that counts down to noon, so I guess that's meaning we're too long-winded. First thing of note is, first thing is approval of minutes.
I was present, sir. I'm not listed.
You're not
I want
listed.
credit. I want all the extra
You want
credit.
full credit, okay?
Full credit.
I make the motion to approve the minutes with corrections.
Corrections. Okay. We have a motion to approve the minutes as amended to include Dr. Greenberg, and a second. All those in favor? Oh, sorry.
Excuse me, Chief Riley, could you look at those minutes? Did you figure out who actually approved them last time?
Oh, right. Thank you.
I apologize to the council, but we had a computer crash, and so a lot of the information got away from us.
Anybody want to
remember?
admit to have motioned or seconded the minutes from last time on council? We're pretty sure it was the judge over here to my right.
I'll take the blame for it
He'll
anyway.
take the blame, and the doctor will second it. Okay, so now we have a motion to approve the minutes amended to include attendance by Dr. Greenberg, and then the approval of the minutes at the last meeting was by Judge Deloach and seconded by Dr. Phillips. All those in favor?
Aye.
Any opposed? Thank you. In keeping with our strategic plan for the council, which we will discuss later in the meeting, one of the things we want to do at the beginning of each meeting is to read the vision statement and mission statement as they exist today. The vision and mission for the Texas EMS and Trauma System is a unified, comprehensive, and effective EMS and trauma system for a healthy, safe Texas. And the mission is to promote, develop, and maintain a comprehensive EMS trauma system that will meet the needs of all patients and that will raise the standards for community health care by implementing innovative techniques and systems for the delivery of emergency care for the entire population. And we read that at the beginning as a kind of a guide or a signpost when it comes to voting and making decisions that impact Texans. Lieutenant Smith will not be joining us on the council today. He contacted me yesterday and sends his regards, but he had some unexpected business come up. Also, if some of you remember last year, we had a cheering competition with the room next door, and there's an encore presentation today of that at 11:29. So if any of y'all are game, I'm all for just let's out cheer them and drown them out. So we'll see if we can take off our ties and get wild for about 3 minutes at 11:29. So the other thing, I want to remind everybody we are in living color and being broadcast. When you come to the microphone, be sure you step close, or if you're sitting, pull the microphone close so they can pick it up. We're very grateful to TTAF for broadcasting this meeting, as well as all the committee meetings. And that's all I have under chair report and discussion. So Commissioner Perkins will give her report.
Good morning. A few things. The department has started its legislative appropriation request work for the next session. It seems like the last session just ended, but we start early, and the department must turn in their legislative appropriation request, or LAR, in August. So we're busy working that. I will tell you from my division's perspective, there is probably not a really good likelihood that we're going to see any increases in our appropriation in the next biennium. So, just lay that on the table. It's probably not likely to happen. Last time I talked to you guys about the Medicare fraud issue in EMS, and I gave updates to both the medical directors and EMS committees. A few things, highlights that I will tell you about. We have made some changes in how we're doing, in some things that we're doing with our initial provider surveys, as well as our inspections and complaint investigations. On our initial provider surveys, we're requiring the medical director to be present as part of that survey. During our inspections and complaint investigations, we are asking the medics who their medical director is. We're asking them to how do they contact their medical director, and actually asking that that medical director be contacted. So that's just the beginning. We're also working with the City of Houston, getting a lot of good ideas coming out of the different committees for changes to our rules. And I did have a meeting with the medical board executive director about a month ago, and it was a very, very good meeting. We brought to her the list of medical directors and firms in the state of Texas so that she could see where there were medical directors that had 20, 30, 40 plus firms. We discussed that issue, and they are willing to open their rules and look at a potential cap of the number of firms that either firms and or persons that a medical director could have. They have those kind of caps in some of their other areas. We talked about two particular issues that we wouldn't want to cause a problem with. Our big municipalities that have maybe a couple thousand medics or more, as well as our rural areas that just may not have the resources out there, medical directors out there. So they were very open, and they're going to have an open stakeholder process. If that process begins before y'all's next meeting, then I'll make sure that y'all are aware of it. Told the medical directors and EMS committees that also. If not, I tried to get her to these meetings, but the medical board is actually meeting at the same time. So I'm going to try to get her to the May meetings. But I think one of the most important things that was a very, very important point for me, my staff, and that I am sharing with everybody, is that a medical director can have the most perfect protocols, offline medical direction. But if the medic under that person doesn't know who they are, has never talked to them, hasn't had QI or education with that person, with the medical director, then there's probably a key piece missing, and that's supervision. The delegation and supervision go hand in hand. There's a relationship between the medic and the medical director. And if that isn't occurring, then that medical director is not meeting the current rules. The medical board executive director also indicated that she'd be willing to consider the medical director course issue that y'all have been talking about for quite some time for EMS medical directors, as well as having something on their application that indicates that they're currently an active EMS medical director. So all in all, it was a very, very positive meeting, and I'm hoping that we'll continue forward. Any questions about that? Okay. I wanted to bring up with you just briefly, and you'll be hearing more about this issue, but legal opioid medications are becoming a critical problem, not just in Texas, but across the country. We now have more deaths from drug abuse, legal drug abuse, than motor vehicle crashes, which is just phenomenal. This graph shows you the number of calls to poison control centers from 2000 to current for opioid. We see the same thing, and it follows there has been a fourfold increase in the prescriptions of oxycodone, codeine, fentanyl in about the last 15 years or so. And as those lines have gone up on the prescriptions of those drugs, the calls and the deaths are going up almost right along the same lines. The person this is something that we're becoming much more aware of. The medical board is also involved with this through the pain clinics, the illegal pain clinics that they've been working with. Dr. Emily Becker is the medical director of our state hospitals, and she is collating this information, and so we're going to be helping to get it out. And one of the things that the department may be doing is bringing together a work group to look at this issue comprehensively, and I suggested that EMS and EMS medical directors needed to be represented on that group. Okay? Let's see. I want to mention an issue that's going on. We've mentioned this to the RACs. It's just it's new. I am not conversant on this yet, but it's something that those of you in EMS and trauma need to be aware of, and that is the 1115 Medicaid waiver that is allowing it's going to transform medical care in the state of Texas. They're creating what I am calling RACs on steroids, RHPs, Regional Health Partnerships. And those partnerships are led by, is it a municipality?
The anchor hospital.
An anchor hospital that receives UPL, upper payment limit. And again, I'm not conversant on this, so I'm hoping. But the bottom line is, we're learning as quickly as we can because this is rolling out very quickly and could mean billions of dollars to the state of Texas. So basically, the idea is that with this anchor hospital, they form these partnerships and they develop a plan for approval by HHSC, and they are to address health area concerns, infrastructure, chronic disease, anything that they feel is an important problem in their area, okay? So from my perspective, the structure of the EMS system could be something that could be looked at by these regional health partnerships. Anybody that has unmatched general revenue can put it up with these regional health partnerships, and that money then will be matched. Okay, so that's how additional monies will come down to Texas. I'm getting this. This is really simple. We're hoping to provide more information. I tried to have HHSC come to the RAC chairs to talk to them about it, and we weren't able to make that happen this time either. But you need to be learning about who is your anchor, who are the leads for these regional health partnerships within the areas. All the RACs need to be doing this, because we think, and it may not happen immediately, but we think the money we give to the RACs for EMS, the money we give to the RACs for EMS trauma system development and maintenance, et cetera, running our system, may be, I'm not saying will be, may be able to be matched, okay? And it's small potatoes as compared to everything else, but one of the big concerns that I've had over the last couple of years is all the work we've done for over 20 years to establish our system, and I don't want to lose that system, okay? I want that system. That system is an important part of the healthcare system in the state of Texas, and so somehow we need to be hooked in to what's going on with the healthcare changes in our state, okay? Do you have anything you want to add to that? No? Okay. Okay. So I'm not very conversant, but I know it's out there. I know you need to find out who your anchor is, and we will find out information as we can and blast it out to you guys too.
Who is actually requiring the RHPs? Is that the state is doing that in response to a federal requirement, or?
We proposed it. This was a
Okay.
waiver request by HHSC as to how we could transform the health care in the state of Texas. We really did not believe that it was going to be approved, and it was, and it's going to change things dramatically. Now, HHSC's big focus is primary care. You can understand why that would be, but there are so many other things from the Department of Health's perspective, from chronic disease management to infectious disease management to our systems, that we think we don't want to be left out from this big transformation of healthcare in the state of Texas.
I guess I would add, Chief, if you don't mind, it's kind of two parts. There's the, and again, we're flying the plane as we're building it. It's kind of the analogy we're using here. Everyone's kind of trying to figure out what does this mean, but there's almost two parts. One big part of it, as y'all are probably aware, is Medicaid rolling out managed care across the state beginning March 1st. That's one component of it as well. And then the other is the 1115 waiver, which creates these regional health partnerships with these anchor hospitals to begin to try to improve, transform the healthcare within those regional communities. And so those two big pieces are significant changes in Medicaid. And yes, I agree with Kathy that the more we're all involved in that process from the get-go, will be very, very critical to our success.
And that's all I have, unless you have any questions for me.
Any questions for Commissioner Perkins?
I have a question. I realize that you may not know yet, but you said super RAC. So would that constitute like the trauma service areas, or would that constitute something similar to like what they did with the EMTF project where they consolidated?
It's not going to be a super RAC. What I said is the RHP sounds to me like a RAC on steroids. And the reason I say that is it's because so much bigger than a RAC. It has so much more responsibility and bigger, broader mandate and lots of money at the beginning, which the trauma system didn't have, okay? Tons of money, way more money than even the trauma system has today. So it's not going to, they're not going to, right now they haven't defined any lines or regional health partnership areas. They're allowing them to build locally. And they've actually asked for, HHSC has asked for a meeting with me early next month to talk about what we did in the early years with the trauma system, because one of the things that I've communicated is my concern is as these things build, if you don't require that every county at least be part of one, whether they want to give their money or not, you're going to have gaps and holes, okay? And so that's one thing that I've communicated. So I'm excited that they've asked to talk to me about those early years and how we brought people together to make this work. But it isn't, it is separate and apart from our trauma system. What I'm saying is that it's big, it's about healthcare in Texas, it's transformative, it's changing, it's going to change the way healthcare is provided, and I don't want our trauma system, our EMS trauma system, to get left out.
One of the things, Commissioner Perkins, one of the things that has been active on our listserv, the county judge's listserv this week, has been this same issue. And I was in College Station earlier in the week at a conference, and they were talking about, spent a whole hour talking about this. And one of the concerns is, and I'll preface that with, any time we can get more federal money into the state of Texas, I think it's a good thing. But in most cases, I wasn't necessarily in favor of some situations. But anyway, the concern is with the County Judges and Commissioners Association is that where's the matching money going to come from? And it's because it's got to be new money. And their interpretation of it was it has to be new money. Now,
money that's not currently being
right,
matched.
exactly,
Okay,
exactly,
so it doesn't
exactly.
mean that you have to raise taxes or
Right.
provide new money if the money is not being matched in any way
All right,
now.
And that's one of the questions that I had. And that was